Welcome to the Care for Kupuna podcast, where we dive into health, wellness, and vibrant living of our cherished kupunas. We are thrilled to take you on a journey exploring everything from health and wellness tips, deeply rooted in the spirit of Hawaii, to navigating the intricacies of retirement, preserving our rich culture heritage, and fostering vibrant communities for our elders.
Whether you're a kupuna yourself, a family member, a dedicated caregiver, or simply someone passionate about supporting and uplifting our elders, this podcast is for you. Each episode is crafted with love and the intention to inspire, inform, and celebrate the golden years. So sit back, relax, and join us on this meaningful journey as we care for our kupuna.
Aloha, and welcome to this week's episode of Care for Kupuna, where we care for our kupuna. I'm Lani.
And I'm Trina.
And we are your Kupuna Care Girls. And we are actually recording from the Podfest in Orlando. This is our first Podfest, and we're learning a lot, right, Trina?
Yes.
And we're showing off our new shirts. And we're having a good time learning at the same time. So we're very blessed to be here. But today we do want to share with you how to outsmart the system and what that means. The world has become more digital, virtual and automated. And at the same time, the post-pandemic economy can, at times feel unstable. So we have an article that we found, and we want to share the information with you on how do we navigate this new landscape and make the system work for us, work for you. So let's start with the pharmacy closures. There has been, on Hawaii Island, Walgreens closed down. There might be some CVS or Long's pharmacies that close down throughout the year. And we want to, make sure that you have the right plan that will allow you to go to other pharmacies. So don't limit yourself to a single pharmacy choice, because you might be paying more than you should be on your Medicare plan. So if you sign up on a health plan that gives you more pharmacy options, that would be good. If you're on Medicare and need more options, you can switch your Part D or Medicare Advantage plan that has a prescription drug plan attached to it during the next open enrollment. Starting in, last year and this year, there is an open enrollment that will end March 31st as well. So you do have that opportunity to change plans if needed. Request a special Medicare enrollment period. As I mentioned, there is an open enrollment period right now that will end March 31st. So you do have that option to change if needed. And order by mail, that would be another option that your plan may have available, and it might be cheaper for you. So instead of getting a 30-day supply for, say, $5, you might get 3 months supply for that same amount or even lower. So look at your options when it comes to your Medicare plan with Part D, as in drug, or a Medicare Advantage plan that includes Part D for that order by mail option.
Those are really great tips, Lani. Also, unexpected medical bills. Did you ever ask yourself, where did these charges come from? All of a sudden getting bills from hospital or a lab or imaging company. There's actually a study that shows that in the last 5 years, according to research, it's in 2022, in nonprofit health organizations, that there are more than 43% of adults receiving bills and having issues trying to figure out who's supposed to be paying for these bills, right? Because you're thinking you have a health plan and you have coverage, but do you understand your health coverage? There's about 3/4 of adults who challenged a mistake of unaffordable bill got help from it and actually was able to get it corrected. And that by getting it corrected is bill correction, payment plans, or financial assistance too, a price cut, or cancel the bill entirely. So that's a really good tip too.
Yes.
Ask for an estimate before doing services, double checking to make sure that a procedure is going to be covered. And so that way you kind of know who and where these bills are going to be coming from. So you understand ahead of time. And then don't pay right away. The first bill you get says 15 to 30 days after a medical visit may not have been processed by your health insurance company. So hold off a little bit. You shouldn't pay it right away. Let your insurance company pay first and in that bill, it would actually show a breakdown of it being billed to your insurance company and the portion that it pays. You want to also compare the bills to your insurance. Again, checking your explanation of benefits you get from your insurance company and the bill you get from, say, a healthcare provider, imaging company. You want to make sure that all coincides for the correct date, the correct procedure, correct doctor. And that's another way to keep that in check. Also, another challenge is ambulance. So ambulance tends to be, of course, in an emergency, you're not going to be handing out your insurance card while you're laying there trying to get service. But there's always going to be a number on that bill that you can provide them with your insurance information so they can properly bill.
Those are great points, Trina, because yes, most of the calls that we receive are, hey, I got this bill. Can you help me with it? So you want to understand what you're being billed for and make sure you don't pay for what you shouldn't be paying for.
Yep.
The next step is Social Security help. The Social Security Administration says customer service is improving, but are they really improving? And how can I get assistance when I need it? So, figuring things out with Social Security can be difficult and frustrating. So reaching out to someone who has the answers to your questions, it might take a while when you reach out to Social Security. Now, there's an article that says Social Security Administration has lost more than 10,000 workers since 2010, while there's more seniors who are needing their help. So it might be a challenge to be even trying to contact someone at Social Security. So how to outsmart the system? Be prepared when you call Social Security. Do your research and, go to their website. Consumers don't always know the rules, so make sure you do your research when you call. Know when to call. So if you're calling during the peak hours of the day, then you might not get to someone right away. So Mondays and the days after holidays are the busiest times for Social Security. If a matter can wait, call on Friday, typically the best day of the week to get assistance by phone. And sometimes the agency also recommends calling early in the morning, So that's definitely what we want to recommend. Yeah. Consider alternative locations. So if you need to make an in-person visit to Social Security, check appointments availability. Some might not even have walk-ins available, so definitely check in with that office. And there's also resources, so you can come to us. We have episodes that offer, tips and tricks on how to deal with Social Security.
Yes, and we'll mention that for sure.
Yes.
So Medicare Advantage enrollment has been growing. In this year, there's actually been a huge shift from original Medicare to Medicare Advantage plans. They have saw that from private insurance company raising from 19% of eligible Medicare beneficiaries in 2007 to 54% of Medicare recipients choosing an Advantage plan in 2024. How to outsmart the system here? Consider the co-payments when you're shopping for a Medicare Advantage plan. Look at the monthly premiums, look at the co-payments, especially when it comes to your inpatient hospital stay. You want to compare that. What is their cost overall will be? And is there a limit? Is there a certain amount of days? Or do you keep paying? Those are very important questions that can really add up to your bottom line. Understanding your provider network is a huge part about a Medicare Advantage plan. Is it a PPO? Is it an HMO? Understanding that right there will help save you money. One, if your doctor's even in the network. Two, is that will you get access to the facilities you need to use, right? Considering PPOs, yes, you have in-network and out-of-network, but there's a huge difference between the prices.
Yeah, and it changes every year. Yeah. So make sure you know.
Yeah. Preparing for authorizations when you're on a new Medicare Advantage plans, their system might be different. You may need to have a prior authorization put in place for a certain prescription or a procedure. Knowing that before going into a new health plan helps you prepare to actually save on your money down the line.
Absolutely.
So, of course, all these resources we got was from the AARP website and article. And I want to ask you folks a question here. Now, how can you stay up to date with the Social Security changes for 2025? Because there was a major change here this year.
Yes.
And we want to refer back to one of our episodes, Care for Kupuna, our episode 2 of 2025. So that was a little earlier this month. You want to take a listen to that episode where we touch on all the changes that happened for 2025.
Yeah. Definitely go onto our website and download that episode.
Yes. And share this episode with a friend who's caring for a kupuna or a friend that could use this resource tip, right?
Yeah, yes, absolutely.
Where aloha meets wisdom, one podcast at a time from Orlando. We'll see you next week.
Aboy.
Mahalo for joining us on this episode of Care for Kupuna, where we explore health, wellness, and vibrant living for our cherished kupunas. We hope you found inspiration and valuable insights.
Remember, your support can make a difference. 20% of all proceeds from our podcasts go to a nonprofit organization here in Hawaii dedicated to helping seniors in our community. If you'd like to contribute, visit our website at www.carewithak4kupuna.com and make a donation.
Are you a brand or business looking to align with our mission? Consider sponsoring our podcast. Visit our website for more information on sponsorship opportunities.
For those with stories to share, we invite you to be a guest speaker on our podcast. Head over to our website to express your interest and become part of the conversation.
Last but not least, stay connected with us by subscribing to our email list and following us on social media at Care for Kupuna with a K. Join the Care for Kupuna community to stay updated on all things related to health, culture, and creating vibrant communities for our elders.
We appreciate your time and look forward to welcoming you back on the next episode of Care for Kupuna.